Chad Shafer, physical therapist, here talking about lumbar stenosis. So I had a patient last week that I want to tell you guys about because it's a very, very classic type of patient that you'll see, that I'll see, I guess. So as a person experiencing lower back pain, usually the case is you'll prolong it as long as possible, and usually it gets worse. Maybe you'll try some stretches, some Advil, leave, and see what happens. You know, you wait 3 to 6 months, and then maybe eventually you go to your doctor. And oftentimes people, and this patient specifically, she got a medical diagnosis of lumbar stenosis. So anatomically, what lumbar stenosis is, it's a narrowing of the spinal canal. So if it's true lumbar stenosis that's giving someone pain with this diagnosis, then things like standing and walking for long periods of time are going to irritate their problem. But here's the other notion that you should think about. A lot of people that have lower back problems and hip pain, pain down the leg, they also have problems with standing and walking too long, as well as a whole host of other issues. So this patient specifically, we actually looked at how she moved and found out that she was actually missing a fair amount of motion in an extension position, which is backwards. And anatomically, that's supposed to make your symptoms worse. So it kind of begs the question, is there a link between pain and symptoms and imaging, because she had an MRI, an X-ray on her lower back and found stenosis? In her case, that wasn't the cause of her lower back pain. So if you have lumbar stenosis, cervical or neck stenosis, and you're having neck problems, it's not the end of the world, because there's a lot of research out there that says that the connection between imaging, which is X-rays, MRIs, fun stuff like that, and pain and the problems that you're having on a day-to-day basis, walking, living, having fun with your friends and family, those two things are not directly related. There are very few patients and people out there that have true lumbar stenosis that is directly causing their pain. And those are the people that no matter what you do, this backward motion is not going to give them relief. Sometimes they need a forward flexion or a bending forward motion. So this is just an awesome patient success story, because she did really, really well in a short amount of time. And the best part was that she was sent home with some techniques that she could do to help heal herself. That's the biggest thing, because active therapy is always better than passive therapy. If you've ever been to my clinic, I don't have any ultrasound, e-stim, hot pack, cold pack, all that stuff that probably doesn't even work. A lot of the research is coming out that says it probably doesn't work. And you can really do all those things at home, at least ice and heat. So when you're coming in to my clinic or anywhere to get some help, you got to find active movement therapy, someone that's going to screen you through movements, position, and postures, find things that are going to make you better and things that are going to make you worse, and then build a plan off that so you can get back to your life and get rid of this. Thanks for watching.